my name is Megan. I'm going to be your nurse today. Can you tell me your name and age?
Hi Megan, I'm 58 years old, Sylvia Berry.
Okay, Sylvia, you're here today for a head to toe assessment. So we're going to do a full body assessment. I'm going to be doing a lot of listening all over. We'll do some range of motion. I'll be feeling on you for tenderness and stuff. Doesn't mean anything is wrong. We're just going to be very thorough today, okay?
Okay.
If you have any questions along the way, you can stop me and let me know, okay?
Okay.
So first I'm just going to start off with a little survey and ask you a couple questions, okay?
Sure.
Can you tell me who the current president is?
President Donald Trump.
Okay, and what year are we in?
2020.
Okay. Do you have access to 3 meals a day at least?
Oh yes.
Okay, and I see that you appear clean and it looks like you have a good hygiene. And you are sitting upright and you have a good posture right now sitting.
Thank you.
And I observed when you walked in that you had a good gait. Do you use any assistive devices like a walker or a cane?
No ma'am.
Okay. And is English your natural language?
Yes.
Okay. And how would you say your mood has been lately?
It's been really good, really grateful.
Okay, that's good to hear. All right, and I also note that your height and weight means that your BMI is in normal range.
Oh yes, it has been.
Okay. I'm giving a report today on a 58-year-old female that was in for a head-to-toe assessment. She was awake, alert, and oriented times 3, able to state her name and age appropriately with clear speech. Her BMI is appropriate for height and weight. She has access to 3 meals a day. Steady gait with no assistive devices used, and posture was upright with no obvious physical deformities. Her mood was happy, appropriate, and she has good hygiene. With her skin is warm, dry, and intact with good skin turgor. Her nail beds are clean, and her capillary refills are less than 3 seconds. Her radial and brachial pulses are palpable. Her cranium is free of any tenderness. Scalp is clean and free of any infestation or redness. Her hair is black, with good hair distribution. Maxillary sinuses and frontal sinuses palpable with no tenderness. Cranial nerve 1 through 12 are all intact. With her neck is symmetric, no lumps or pulsations visible. All 12 lymph nodes palpated with no tenderness. Her carotids are free of any pulsations or tenderness. No thrills noted to auscultation. And she has a full range of motion and good muscle strength to her neck. With her eyes, the external structure of her eyes free of any redness or drainage. Her conjunctiva is pink. Her scleras are white. From the side, her corneas are round and her irises are brown. Her pupils are equal, round, and reactive to light and accommodation. With her ears, the external structure is clean, free of any redness or drainage, and there was no tenderness noted. With her nose, the external structure is clean, symmetric, no redness or drainage. Her septum midline, her nose is patent, and her mucosa was pink and moist. Move to her mouth. Her lips are free of any cracks, dryness, or lesions. Her buccal mucosa, teeth, tongue, lips, hard, soft palate, and tonsils are moist without exudate. Her thyroid is free of any tenderness or enlargement. Move to her lungs. Posteriorly, appropriate AP to T diameter. Scapula symmetric, spine midline. Anteriorly, her respirations had a rate of about 20 with no use of accessory muscles, even and unlabored. There was no tenderness, anterior or posterior. No CVA tenderness posteriorly. Her lungs are clear bilaterally to all lobes, anterior and posterior, and her trachea is midline. Um, her heart Her heart sounds were auscultated sitting, lying, and lateral, with no murmurs or thrills noted. S1 and S2 were noted with regular rate and rhythm, and her apical pulse was palpated at the fifth intercostal space, left midclavicular line. We moved to her abdomen. There was good contour at eye level. It was flat, no scars, appropriate color. No pulsations, no visible peristalsis, and her umbilicus was midline. Her bowel sounds present in all four quadrants. There was tympany to percussion in all four lobes, and no tenderness to deep or light palpation in all four lobes. We then moved to her lower extremities, and her lower extremities are symmetric. Her skin is warm, dry, and intact. No edema, good hair distribution, no visible varicose veins. Her pulses, femoral, popliteal, posterior tibial, and dorsalis pedis are palpable. She has full range of motion and good muscle strength to her lower extremities. She has full range of motion and good muscle strength to her upper extremities as well. And her heel to shin test was negative. Her patellar reflex was positive, and her scoliosis screen was negative.